Alright, I know this looks kind of scary. What this bone is the sphenoid bone if it was disarticulated, meaning we dismantled the entire skull and took each bone out one by one. Now the sphenoid is pretty special. I think I've said it before in some of the other videos. Basically, we build the whole skull around it. The face, the cranial vault, the base of the skull, the lateral sides of the skull. So I wanted to pull it out by itself so I could explain further its parts and purpose. So what we're looking at here is an anterior view of the sphenoid bone. So what you're seeing here is what you would see in the back of the orbit, so the posterior wall of the orbit with our superior orbital fissure and our optic canals on the right and left side coming out and going into the eye. Now this part kind of looks like an owl, I know, but these holes connect to our sphenoidal sinus, so that's what's inside. Now these are our pterygoid processes, kind of looks like little feet if it were a bird. So these pterygoid processes have the plates on them, and those form important muscle attachment sites for muscles of mastication. So now if we look at it from a lateral view, so from the lateral view of the skull, this is the portion of the sphenoid that we're seeing, and our pterion would be here. From an internal perspective, this is what we saw. So this would be the floor of the anterior cranial fossa. Again, this is known as the lesser wing. This is the greater wing, which is the floor of the middle cranial fossa. And again, if we look at the openings, so here's our optic canal on the right, optic canal on the left, sella turcica here, Turkish saddle, our superior orbital fissure on the left and right, and then some of the other openings of the sphenoid that we talked about before, the foramen rotundum on the left and right, and the foramen ovale and spinosum in the floor of the middle cranial fossa. Now remember, the foramen lacerum would be right here, but because it's a junctional hole, we don't see it literally anymore. And last but not least, from an inferior perspective of the skull, so this is anterior, this is posterior, this would be the back of the nasal cavity. And our pterygoid processes here, with our little plates on the medial and lateral side, kind of look like little sharp projections. That's what we're seeing from the inferior view. So I hope that helps a little bit.